Hello everyone, I hope all are doing well. Here is a video regarding our Viva model. Come on, let us all look into it.
Good evening, do you need any help?
Yes, I am searching for a book.
Which book do you want?
I need a book on orthopedics.
Well, that's on the shelf of medical books.
How fine. Can I borrow the book?
Do you have your library card?
No. How can I get it?
Well, you need to write an application to the principal as asking for a library card. You will have to submit one copy passport size photo along with your application.
Thank you. I'll submit it soon. But certainly I can read it. Of course. New friend, when will 13B bus arrive in this bus stand?
Within 5 minutes.
The new.
Good morning, Sid.
Good morning. Why are you looking sad?
I'm just tense about my exam.
Don't worry, all the best.
All the best.
What is your name?
My name is Sid, my roll number 57359.
Okay, Sid, tell me one condition which you know very well.
Cerebral palsy.
Are you sure?
Sure, ma'am.
Okay, Sid, listen, I just asked the question only about cerebral palsy.
Okay, ma'am.
What is cerebral palsy?
Cerebral palsy, CP, refers to a group of disorders that affect muscle movement and coordination. In many cases, vision, hearing, and sensation are also affected. The word cerebral means having to do with the brain. The word palsy means weakness or problems with body movement. CP is the most common cause of motor disabilities in childhood.
What are the common causes of cerebral palsy?
Delays in reaching motor skill milestones, such as rolling over, sitting up alone, or crawling. Variations in muscle tone, such as being too floppy or too stiff. Delays in speech development and difficulty speaking. Spasticity, or stiff muscles and exaggerated reflexes. Ataxia, or a lack of muscle coordination. Tremors or involuntary movements. Excessive drooling and problems with swallowing. Difficulty walking favoring one side of the body, such as reaching with one hand. Neurological problems, such as seizures, intellectual disabilities, and blindness.
When was the cerebral palsy symptoms appear in children?
Most children are born with CP, but they may not show signs of a disorder until months or years later. Symptoms usually appear before a child reaches age 3 or 4.
What are the causes of cerebral palsy?
Asphyxia neonatorum, or a lack of oxygen to the brain during labor and delivery. Gene mutations that result in abnormal brain development. Severe jaundice in the infant. Maternal infections, such German measles and herpes simplex. Brain infections, such as encephalitis and meningitis. Intracranial hemorrhage, or bleeding into the brain. Head injuries as a result of a car accident, a fall.
Who's at risk for cerebral palsy?
Premature birth, low birth weight, being a twin or triplet. A low APGAR score, which is used to assess the physical health of babies at birth. Breech birth, which occurs when your baby's buttocks or feet come out first. Rh incompatibility, which occurs when a mother's blood Rh type is incompatible with her baby's blood Rh type. Maternal exposure to toxic substances, such as methylmercury, while pregnant.
Good. Explain the treatments of cerebral palsy.
The goal of treatment is to improve limitations and prevent complications. Treatment may include assistive aids, medications, surgery, speech therapy, physical therapy, occupational therapy, recreational therapy, counseling or psychotherapy, social services and consultations. Assistive aids include eyeglasses, hearing aids, walking aids, body braces, wheelchairs. Medications, oral anticonvulsants and muscle relaxants are commonly used as first-line treatments for CP. Surgery. Orthopedic surgery may be used to relieve pain and improve mobility. It may also be needed to release tight muscles or to correct bone abnormalities caused by spasticity.
Good. What are the types of cerebral palsy?
There are several different types of cerebral palsy: spastic, ataxic, athetoid, hypertonic, and mixed cerebral palsy. These conditions are classified based on mobility limitations and affected body parts.
Explain spastic cerebral palsy.
Spastic cerebral palsy causes children to have exaggerated reflexes, spasticity, and stiff, sometimes painful muscles. The majority of children will experience some degree of difficulty walking, depending on the type and extent of spasticity they have. Spastic cerebral palsy is broken down into 3 different subtypes, which include spastic diplegia, involves muscle stiffness, generally in the leg area, but the arms may be mildly affected too and can cause difficulty walking. Spastic hemiplegia, when primarily one side of the body is involved, with movement difficulties mainly in the arm on the affected side. Spastic quadriplegia, characterized by motor dysfunction all over the body.
Nice. What is ataxic cerebral palsy?
Ataxic cerebral palsy. Children with ataxic cerebral palsy exhibit uncoordinated, jerky movements. This is the least common type of CP. The movements are initiated by a voluntary effort, which then becomes interrupted and uncontrolled, causing a lack of balance or coordination. There can be difficulties in walking and writing due to instability, effects on speech and swallowing, as well as eye movements.
What are the symptoms of mixed cerebral palsy?
Stiff muscles with involuntary movements, a combination of spastic and floppy movement, seizures, cognitive issues with speaking and swallowing, hearing problems, drilling and facial grimaces, vision problems, including lazy eye and cortical blindness.
Good, you may go now.
Okay, thank you, ma'am.